Hello and welcome back to the Holistically Awakened podcast. I'm so excited to be back because I took a little bit of a break during Christmas and December, and now I'm back. So I have some really cool episodes that are going to be lined up for you, solo episodes, interviews, and I'm just so excited to start this conversation all over again. So before we get into the topic today, talking all about the mind-body approach to health with Holly and Lauren, I wanted to remind you guys, if you haven't heard already, maybe you've seen me talk about it on Instagram, but my coaching program, Elevate You, so my one-on-one PCOS holistic coaching program, starts again next week. And this is basically everything you need to know about how to manage your PCOS holistically. So imagine having your own PCOS strategy with somebody to guide you all along the way so that you don't feel lost about what to do or how to implement it, or if this is actually going to make a difference for you. This really helps you understand what's going on with PCOS, but then also how to understand your own body. So not only do you have the protocol, the strategy, but you also have guidance, accountability, and a group of women who get you and support you, because this is really not something to navigate by yourself. So this is really made for you to have clarity and confidence around what you're doing and how to manage PCOS. So you can bypass the unnecessary struggle with somebody who's been in your shoes and who actually has done the research. So you have a blueprint to help you reach your goals this year and to actually understand how to manage this over the long term. Because that's really the whole point. It's getting to the root of your PCOS issues so that you don't have to constantly get a Band-Aid after Band-Aid after Band-Aid because you have symptom after symptom after symptom. So we help you address the root cause of your PCOS symptoms so you can start to balance your hormones and feel good in your body without restricting or feeling overwhelmed. So if you're interested at all, if you'd like to know more, I will put the link in the show notes about Elevate You, my holistic PCOS coaching program. If you would like to apply, please do so, and I will contact you so that we can chat and see if this is a good fit for you and address any questions that you have. So I would love, love, love to support you if this is something that you really want to get a hold of this year and you want to make real change that's lasting. I would love to hear from you. So without further ado, let's get into today's episode. We're going to be looking at the mind-body approach to health because there is a mental health crisis going on and we really need to address that from a holistic standpoint. So this means, what are we putting into our bodies, but then what is also going on with our stress and our lifestyle and our thoughts. So today's episode is going to be all about that and giving you tangible steps as to where you can actually start and apply this in your own life so that's actually sustainable for you and you can take what we talk about and apply it to your situation. So I'm so excited for you to listen to this and I hope you love it. So hello and welcome Lauren and Holly to the podcast today. I'm super excited to chat with you guys.
We're super excited to be here.
And
Thanks,
so I know
Lauren.
we're going to have a really great conversation because it's all about mind-body approach to health, which I think we're all very passionate about, which is why we're also found each other. But it's really about, you guys are really about combining your specialties of dietary science and mental health to offer alternative solutions for individuals to achieve a healthier lifestyle. So that's what you're really all about, right? Combining the mind-body approach, which I love so much. And so really my first question that comes from that would be, what made you interested in this line of work? Because I love to learn about how people get into this, because it's really never a coincidence. It's not just like, oh, I've always wanted to do this. It's usually something happened for them, right? So I'd love to hear like what happened for you and what brought you to this line of work.
Yeah, sure. So I can go first. I'm a licensed clinical social worker, and I have a specialty in treating anxiety. Right now, I'm offering private sessions out of Northern New Jersey, and have been doing that for 15 years. And what got me into this line of work is that many members of my family cope with anxiety disorders. And I was especially interested in how psychology affects all types of relationship dynamics. So all different types of relationships are affected by anybody who is suffering from stress or mental health issues. So that's what led me first to the undergraduate work I did in psychology and interpersonal communication. Professionally, I'm focusing on anxiety and women's issues throughout the lifespan, especially during big life transitions when that stress level is super high. So as you said, nobody gets into this line of work without it being something that they're going through themselves. So for me, I found lots of anxiety and stress during those big life transitions, whether it be when I went off to college and was living on my own for the first time, or when I was first engaged to my now husband. Those especially stressful times really had an impact on me. Also, through my 15 years of clinical practice, I've seen firsthand how stress and anxiety can wreak havoc on the physical body as well as the mind. That began my focus on what sort of mental health changes we can use to positively impact our physical health, our relationships, and our environment.
And I'll go next. This is Holly DeLong, and I'm a registered dietitian. And Lawrence, like you said, it's so true. And I hear this from so many other health professionals. It was something in my life that changed my line of work. So I started working in corporate HR right out of college and worked there for 10 years. And I never thought I would pursue anything different. I just thought I would work in the business field. But I started having my own health issues. That's how I found you. I never was officially diagnosed with PCOS, but I felt like I had all the symptoms, exhibited all of the signs, had some of those biochemical markers. So I think a lot of the health advice for PCOS, you don't necessarily need that diagnosis. It can apply to a lot of women that are just suffering with those hormonal issues and everything. I also had interstitial cystitis, which is a bladder condition. And it seems that PCOS and bladder issues actually kind of go hand in hand, unfortunately. I hear that from a lot of women. So in my 20s, I just felt like my health was falling apart. I was going to a million different doctors. I was on antibiotics all of the time for the bladder issues, which caused my gut health to be totally destroyed. And I was just, suffering with so much acne. My hair was falling out. My stress levels were through the roof. My mental health was terrible. I was just anxious and depressed all the time. The future looked so bleak. I was just like, how can this be the state of my life in my 20s? And I went to a million different doctors and just was kind of disappointed with some of the conventional approaches. I was given probably 10 different prescriptions that I didn't ever get filled. I just kind of felt like this isn't the way. I know that my body can heal itself. I need to figure out how to do that. I trust that can be. So I started changing how I ate. I started taking targeted supplementation. I really worked on my mental health through things like gratitude and exercise. And, I just saw such a dramatic transformation. It doesn't happen overnight, but little by little, all of those things started improving. And I was just inspired. So I decided to take the leap and leave my career and go back to school and totally uproot my whole life and become a dietitian. Nutrition was the area that I felt particularly passionate about, but I feel like nutrition covers so many different areas. So that is why I became interested in this. And I have never regretted it. I just love seeing that transformation in other people and how powerful a holistic approach can be.
I love it. And I can relate so much to just feeling like you're broken. And when I was going to doctors, it's kind of like, oh, well, there's literally it almost felt like there was nothing I could do because everything I tried wasn't working. And it was just kind of like very defeating. So I 100% can relate to like that frustration and everything. But I also do agree that it's not something you can ever regret because even if you don't go into like a career, it's benefiting you obviously, but then people around you and you're, influencing your family and your loved ones. And so it's literally just a trickle effect and this domino effect that can affect so many people. So I love that. And I love that you're using it as your career now because then you can impact so many more people. And so I know that now mental health is definitely a hot topic with, unfortunately, the rise of mental health issues, specifically since the last year. But I'd love to know your opinion. What would be, in your opinion, the top influences on mental health?
So the top influences that I see in my clinical practice with mental health start with self-worth. You know, a lot of people come to me, male, female, different stages in their life, where they're really not making themselves a priority. My challenge is typically to get people to put their own sense of wellness and health higher on their totem pole of needs. We're so focused on keeping everybody else happy and really keeping up with our daily lives that we lack self-care a lot of the time. And what that does is it leaves us feeling very helpless. Like you had said before, it's this feeling of my health is suffering and there's really no answer. And we all kind of ascribe to this thought that our bodies should be able to heal themselves, and they can if we make it a priority. And that's really lacking from what I see. Once people begin to put themselves first, they feel empowered, they make better choices. So in their diet and their lifestyle, which leads naturally to more energy and less feelings of depression, anxiety, and we're better able to cope with the stressors that come our way.
As a dietitian, I can so much attest to that. And that's one of the reasons why Lauren and I really decided to partner. So I'll be counseling people on things like blood sugar management, which is so important to mood and mental health, the quality of a diet, providing those nutrients that are necessary. But sometimes that core desire to put themselves first, or that, you know, that belief that they are worth that, is missing. And I can only get so far. So that's really why we wanted to kind of partner together. But some of the big things just in dietary counseling and what you eat and lifestyle that I see are definitely blood sugar. You know, that can be anything from not having frequent meals, skipping meals. I hear from so many people that suffer with anxiety and depression or just mood instability that they don't eat for the first time until maybe 2:30 in the afternoon. And, you know, that's one of the biggest things that we'll work on right away, is making sure to keep with regular meal frequency. Breakfast is so important. It starts you off without glucose in the body. Your muscles and your brain don't have the energy they need. You end up feeling tired, angry, and that, you know, all of that feels very much like depression, even if not clinically diagnosed. So I think blood sugar is a really big one. Gut health is also really huge. So I have yet to probably speak with anyone who shares with me that they're really struggling with their mental health, that they don't have some sort of gut challenge. Whether it's when you're feeling upset, it affects your digestion, or, you know, for me, I shared with my personal experience of being on so many antibiotics that my gut microbiome was just so off balance, and all of that good bacteria that influences our brain and our mood was just missing. So that was a big piece for me to be able to kind of get my mental health under control, was to gain control of my gut health. So those are really big things. I think sleep also cannot be underestimated when it comes to mental health, as far as importance and influence on how you feel, how you interact with others throughout your day, your energy levels. So I think, you know, those are some of the biggest things that I focus on as a dietitian.
Yeah, and I love that you are bridging it together, because I also learned the hard way that nutrition isn't everything and we can't have one without the other. The mind affects the body affects the mind. And we need to remember also that the body does follow the mind. So this is where we also hear stories of like remissions or like miracles and things like that, where it's literally a perspective shift or like a shift in the mindset. And it's just so profound, because our body is literally listening to our thoughts, our beliefs, all that kind of thing. It's actually proven by science now, which is so cool. It's not just like, you know, stuff that people are saying. So I love that you guys incorporate both of them. And I love what you were talking about first, before we dive into the food, Lauren, with shifting with the self-worth piece, because I think it's, for me and with so many women that I coach, it's really shifting from this victim place to actually becoming in charge of your life and your body. And this is just so empowering to see women shift towards that. But it doesn't always happen overnight, right? So how do you help people shift? Because I know for most of us, like you were talking about, it's just always, especially women, like we're serving others. Like
Yes.
it's always putting other people first. And then we're kind of like, what is self-care? Like, I don't even know how to love myself, right? So
Uh-huh.
how do you even start with that?
So I'm really glad that you brought that up. I'm really passionate about talking about how to empower people and really get them to the highest version of themselves. And a lot of times that is so arbitrary. It's like this idea that's out there, like what exactly, as you said, what is self-care? Um, Self-care, I would define as anything where you're giving yourself a moment to pause and just kind of take stock of what's going on around you. So it's kind of like a mindfulness approach to life. You can carve out time for that at any point in your day, as long as you are attuned to needing that in your life. So being able to self prioritize is something we all struggle with because we're kind of caught up in the rat race of life. It's really that pause that I'm talking about that allows you to slow it down, be present focused, and just kind of reset. Breath work plays a huge role in that. So, sometimes just being able to take a deep belly breath, engage that diaphragmatic breathing, helps people take that pause and helps to recenter. That is what will allow you to cope with and create these small, sustained changes that really propel progress forward.
Yeah, it truly is like the simple steps because I think we
Yes.
just tend to overcomplicate everything. And a lot of the time we're just like, okay, what's the supplement or what's like the crazy protocol or detox? And it's like people are not sleeping properly. They're not taking a breath. They're not taking like 5 minutes of their day to just like sit still. Like it's the little things that really make a huge difference. So I'm really glad that you touched on that because that is something that anybody can do. You don't need to buy breathing. You don't need to
Right.
like, it doesn't cost you anything. So anybody can do that at any time. It's so accessible.
And the best part is that aside from it being free and accessible, no matter how you do it, you're doing it right. So
Mhm.
if you just take that deep breath, take your biggest breath of the day, you've done it right. You've been mindful. You've been able to check in with yourself. You've practiced self-care.
Yeah, there's no way you can get it wrong. And there's literally, I love to incorporate breath work and recommend it as well
Mhm.
because it literally can't do you harm. Like literally
Yes.
it can't harm anybody, and it's just so beneficial and so simple. I love it. And so moving towards more of the food approach, Holly, what would you say specifically when we get into the food? I know we talked about like blood sugar and things like that, but how exactly does food influence people's mood and vice versa? And like, what kind of food does that mean? Because I think a lot of the time now we're stuck in like the labels and like the vegan and the keto and the paleo, and we're just kind of getting away from individual foods and like whole foods and all that kind of thing. So I'd love for you to address that a little bit.
Yeah, absolutely. So I feel like food influences mood in so many ways. It's not even just the individual components of the food. It's just food is so intertwined with our emotions. It can't possibly be separated. So even when it comes to the choices that you're making, I hear people come to my sessions and they've not felt good about the choices that they made, and they're expressing guilt, they're expressing shame, they're expressing fear for now what's going to happen as a result of that. So it's not only just, I want to start with that, it's not only just what you're putting in your mouth, it's the reaction to your choices. And then when you're feeling good about your choices, you can then feel confident, you feel pride about it, you feel fulfilled. So it's just so intertwined, food and emotions. It's really complicated, but it's so interesting to me. Food obviously brings a lot of pleasure. It's all shaped around social experiences. And I hear that so much from people. I just want somebody to tell me what I need to do. What is the macro combination exactly that I need? Or should I be following keto? Should I be doing intermittent fasting? There's so much information out there that people are confused. I am always just a believer, like you said, it doesn't have to be so complicated. Whole foods should be always a central focus, I think, when you're trying to impact your health, whether it be mental or physical. I think we get away from that, like you said. So we're out there in the grocery store and we're looking for all of those little marketing lines that the food manufacturers are putting in our heads, but it really doesn't have to be that complicated. Just choosing whole foods, obviously including plenty of those beautiful fruits and vegetables. Those are some of the most nutrient dense foods. And I always try to remind my clients that, you know, these nutrients are essential. That means that you need to eat them. You don't make them. They're essential to consume, and your body requires those to function properly. So focusing on those plant foods, whether it be fruits and vegetables or whole grains or beans, all nuts, seeds, all of those things provide loads of all of those essential nutrients. And when you're eating a wide variety of them, you don't have to get yourself focused on, okay, if I want magnesium, what should I be eating? If I want B vitamins, what should I be focused on? So it's just, you know, including a wide variety of plant foods is the simplest way, I think, to have a well-balanced diet that's going to be geared towards stabilizing mood, providing all of those precursors to neurotransmitters that we need to feel good, as far as you know, the actual biochemistry that's going on in our brains to produce those feel good hormones. So that's really my philosophy. I really try to simplify it for people because people get overwhelmed and they get confused. So I always try to focus on more of an addition approach versus a removal, because I feel like the more you add in those whole plant-based foods, the other foods tend to kind of remove themselves more naturally. And it's just, it's easier to contemplate adding things than to feeling, you know, to removing things and feeling deprived. Obviously, there's some people have individual issues where they have to avoid certain foods, but just generally trying to improve a diet, I always try to focus on, can we add in 1 serving of vegetable a day for now? Or how can you incorporate vegetables into your breakfast? Because a lot of times people don't eat vegetables at all until dinner time. And then it makes it hard to kind of get a wide variety of those in a nice, you know, high amount. So that's really where I focus on, trying to simplify it, trying to be balanced with it, you know, trying to avoid all of that guilt and shame that can come from just eating a cookie or a piece of pizza. You know, focus on the positives. Don't get so held up on, you know, always being 100% perfect. That's so much of what I see from my clients, them being hard on themselves when they have a little lapse. So just trying to kind of focus on, most of the time you're making good choices, choose plant-based foods, look for that vibrant color that comes with fruits and vegetables, and that's going to provide you a wide variety of those nutrients that we need to maintain a stable mood and support our brains for good mental health.
I love those tips so much, especially like with the relationship to food, because I think that if we have a toxic relationship with food and like if we have anxiety around the meal, then it's actually worse. Like we're not going to actually be getting all the benefits, right? So for instance, if somebody's eating a salad and they have this like stressed, anxious state, they might as well just eat like the more unhealthy food if they were in a more relaxed state almost, because it's like literally doing them more harm, right? And I see that all the time. And I really like that you brought that up. I also love that you brought up like the variety, because that's also one of the key components to like a healthy gut. It's really variety in plants, right? Because I think we're always looking at like, what's the superfood I need to take and what's the supplement? But really the superfood is variety. Like eat a variety of plants and vegetables. So I love that. And then your last point with like crowding out, I just love that approach, because we're always looking at, again, like what should I avoid, and it's just like diet mentality, like, oh, now I have to like avoid all of these foods, and then it never works, right? Like it never ever works, because our body just rebels against this restriction. And I feel like if we just crowd out our plate with lots of fiber and nutrients, then we naturally are not like, oh, I don't really need anything else because I feel full, right?
Absolutely.
I love it. Awesome points. And I know that this is even more important today in regards to what's going on, right? But At the same time, I've noticed, and I've also seen reports showing that things like alcohol consumption are going up. I'm pretty sure junk food consumption is also going up, like fast food. Um, but there are obviously different reasons for this. In my opinion, one of the big ones is the mental health crisis, and we're, focusing on these quick fixes and coping mechanisms and things like that. So I'd love to hear your opinion on that, and what, like, why is it really so important today to really focus on these key aspects of mind health, so focusing on our mindset and what we're putting into our bodies?
So it's especially important today with the pandemic. As you said, there is a mental health crisis, and it's been brewing well before the pandemic. And substance use is on the rise. Depression and anxiety are on the rise, and there's no surprise. There's a lot more suffering out there now due to loss. There are high degrees of fear and dread out there of what's going to happen. And you could see it just in how many people are seeking therapy. I think Talkspace, which is a telehealth platform for therapy, is up almost 30% since 2020. So there's a lot more people out there who are seeking mental health treatment. In a way, being a mental health provider, that's a good thing, because a lot of people in the past really are hurt by the stigma that is around therapy. People mostly suffer in silence. And as much as we want to say that mental health has progressed, and it has, the conversations that are happening need to be a lot louder. And as a therapist, this makes me really happy that people are starting to talk about this mind-body approach. Because I think that that's the way to lessen the stigma around mental health, is to really understand that it's not just quote unquote in somebody's head. It's actually a part of their brain. It's based in their brain. It's chemical. These are chemical reactions to environmental stressors, and it's lovely that we have the science to back that up now, because it goes very far in the realm of empowerment. So in terms of COVID, the isolation that people are experiencing, not having that normal social interaction, really increases those feelings of loneliness that people are having. That has a direct impact on feelings of sadness and depression, loss of interest. So we're not living in the best time for wellness, let's say it that way. But at the same time, there are a lot more resources out there now than there ever were before. So being able to access telehealth therapy has really helped a lot of people, which is good. That it means we're moving in a really good direction.
I think from a food perspective, so there's a lot going on there. The mental health challenges absolutely are influencing people's choices, but as you said, alcohol consumption, fast food, convenience, snacking, we're home all the time. The fridge is always there kind of calling your name. But I think it's a lot about habits changing and routine totally disrupted for so many people. So many of us are home where you're used to kind of keeping a tight schedule. I hear people saying, I used to get up and go to the gym, and I would make my smoothie and then go to work, and I would always get a salad from this place. So now we're having to kind of reinvent all of that. And in a lot of ways, being at home can support it. But when you're kind of left floundering, where you're not sure how to create new habits in your new environment that was supposed to be temporary but is continuing way longer than I think we all ever thought, I think that's a big factor. I do think there is some general increase in people wanting to pay more attention to their health. But at the same time, I think that's causing a bigger problem with this, information overload. We referenced it earlier where, there's some magic supplement that's going to take away all of your problems, or here's the next diet you should be following, or, carbs are terrible, or no one should eat certain foods, that just all of this stuff that's creating this fear and this confusion, while people are trying to pay a little bit more attention to their health, then they're feeling defeated and deflated. So that's really where a lot of our passion comes from, and is trying to provide simplified but comprehensive, proven, evidence-based strategies that are going to work, and hopefully in a simplified process, in a simplified way that can be actually implemented in a way that doesn't feel overwhelming. I think boredom is another big factor. So, people are at home, that you maybe watched everything there is to watch on Netflix, and you tend to kind of snack when you're bored. It's an activity that, even if you're not hungry, you may go to. So I work with my clients a lot. I'm trying to find a replacement for that. When you feel bored, what is something that could actually satisfy that boredom in a more fulfilling way, and also help you to stay on your health goals, where you're not going to be reaching for something, a snack that you really don't want to be eating. So whether that's, taking up a new meditation practice, or getting outside, or moving your body, or reading a book. I know a friend who's taken up paint by numbers. So trying to just kind of get creative with dealing with some of that boredom that is created by just the total change in the way we live our lives, lack of socialization and activities, that tends to make people want to go towards food or feel depressed, and, can really just kind of fulfill that perpetual cycle of mental health, poor food choices, mental health, feeling bad, your mood is terrible, so you make more poor food choices. So trying to kind of interrupt that cycle that more people now are dealing with because of COVID than ever.
Yeah, I 100% agree. And I think I see a lot of the time with like the boredom and all that kind of thing as well, like lack of really a purpose. Because if we don't really have like a bigger vision, whether that's, for ourselves, our family, the world, whatever it is, like you don't have to be like a monk or anything, but just having some sort of like bigger vision for your life, I think is huge. And it can really help us move forward instead of just look at the present moment and seem like it's just doom and gloom, right? So I think that's a really important, there's so many aspects to really address, but what would you say, as we finish off here, would be your top 1 to 2 tips to support mental health during this time? I know we talked about a lot of stuff, but where can really people start?
So I recommend starting by establishing a daily routine, committing it to paper, and actually block time off in your schedule. Starting small, we talked about those small changes and then building upon them. So you could start as simply as setting a wake time for yourself every day, no matter what happened the day before, the night before, what you have planned for the day. Set a wake up time and commit to it. Also, setting a bedtime is very helpful, because it starts the wind down process and it aids in that sleep that we were talking about. This is a really quick way to self-prioritize, and it's a form of self-care. So establishing that daily routine, I would say, is number 1. Number 2, limiting social media and the news. So actually using your phone time limits, because I know you could set them for certain apps, giving yourself permission to use those apps for a very finite amount of time and sticking to that. There's a lot of negativity in the news. There's a lot of comparison happening in social media, and these are really counterproductive to wellness and positive mental health. Thirdly, I would say, as we said before, breath work. Every day, making sure that you take one deep belly breath. It'll help lessen the severity of the stress and anxiety you feel. It is a mental reset button. And it's a powerful tool to help, of course, if you're having racing heartbeats, and just to help calm your mind down.
And I would say my top 3 tips from more of the food side is it's related to Lauren's as far as keeping the schedule. I think our circadian rhythms are so important to your mood. So, and the environment we're all living with, where we may not leave our house for days at a time, it kind of throws all of that off. So sticking to a regular sleep schedule, but then from the food side, sticking to a regular meal schedule. So instead of just snacking all day, or, some people are telling me they don't feel the same appetite cues that they once did when they're home all day. So actually scheduling a mealtime, say, decide when you're going to eat breakfast, lunch, and dinner, and when your snacks are going to be, and kind of stick to that as closely as you can. So you're keeping up with supporting your circadian rhythms and making sure that you're supporting stable blood sugars. All that will go so far as mood. Another thing I would say, since we are home more, is experiment in the kitchen. I think cooking skills, don't have to be a culinary genius or become a chef, but just learning some more kitchen skills, some cooking skills, experimenting with new recipes. I think that is so important when it comes to just building your tool belt of healthy eating habits. So this is a great time to do that. So I would encourage people, find a recipe that excites you, make it an event, and start experimenting in the kitchen more. And thirdly, I would say make time to step outside, even if that's for 5 minutes of breathing or taking a walk, just, getting some fresh air and just getting some time to go outside, I think really goes a long way.
Amazing tips. Thank you so much for sharing. We do have like 3 minutes left, so we might have to hop back on, but I would love for you guys to talk about what is Food and Mood.
So Food and Mood is the company that we started that kind of just encompasses everything that we're just talking about, the importance of that mind-body approach. So Lauren from her mental health expertise and me from the food dietary side, there's such a need for that intersection between mental health and nutrition, I think, and that collaboration. So that's really what Food and Mood is all about, that collaboration, approaching people from a mind-body approach instead of just addressing one at a time. With that, we're launching a program that kind of takes a lot of these tips that we talked about and breaks it down into a very digestible way called Holistic Happiness. It's going to be online, which is great for this type of, the environment we're living in. It's going to include one-on-one support as well as group support. So that community is just so huge for sharing ideas, sharing support, empowerment, like we talked about. So that's really something we're going to focus on in our program. It'll be 8 weeks long, like I said, all online. We are offering a discount right now. So if people just visit our website at yourfoodandmood.com, they can read all about the Holistic Happiness Program. We have a quiz on there where you can take some, answer some questions to determine if it would be a good fit for you, and just learn a little bit more about it and see our discount that we're offering right now. We're launching the program January 25th. Which is a good time now as we're all tending to kind of refocus and create those resolutions, maybe doing a little bit more goal setting than we normally do. So we're really excited about it. We're only accepting 20 participants in order to kind of have that tight-knit exclusive experience. So enrollment is open now. Definitely check it out. And we offer a consultation if anyone just isn't sure and wants to hear more about it. We're happy to jump on the phone and talk about it more.
Okay, awesome. Thank you so much for sharing about Food and Mood, the Holistic Happiness Program. Super excited for you guys. And I think this is so valuable, especially now. I mean, we need it more than ever, as we talked about. So I will put the links in the show notes for anybody who would like to check that out. Also to follow you guys on your website, your social media platforms. So you guys can check that out in the show notes. Otherwise, thank you so much for coming on today. I thought that was a really valuable chat and I absolutely loved it.
Thank you so much for having us on, Lauren. It's really nice to collaborate with you.
Really enjoyed being here, and I love the content you put out. So I'm really excited for our first collaboration.
Thank you for listening to today's episode. I hope you loved it. And as usual, if you do enjoy the episode, the podcast, I really appreciate a 5-star rating and review on iTunes. It really helps my podcast reach more people who need it and to spread my message. So I really appreciate your time for tuning in, and I can't wait to share what's coming next week.